The leader, I
We're
had,
back on. We're back on. So
so it will cut off in the next hour.
yes.
All right.
So we'll cope with that.
Just,
All right.
just send me
So
the updated link so I can send out the post.
it's the same link.
Was the same link?
Same link.
Okay. Good.
Should be the same link. Yeah.
Let me check.
Mhm.
No, it's not the same link.
It's not the same link. Crud. All right. I'll wait until Chris shares that, but could we get Diopal ready? Diopal, are you ready? All right.
Emma, can you send the link to me? Because I haven't seen it pop up on YouTube yet.
Anything yet?
You got everybody's here?
Yeah. Did you get the link?
Where you sent it? Slack?
No, I was wondering if it popped up.
Let me check right now.
Okay. What's the YouTube page?
Nexus Hubbing. Okay, it's back up now.
All right.
Yeah, the URL definitely changed.
All right. Sorry for that break in transmission. We'll continue the presentations with Diopal's information portal. So, Diopal, take it away. Are you ready? Doesn't seem as though you've got any audio feed. Can you guys hear me?
Yeah.
Okay.
Yeah.
Diopal, are you having technical difficulties? Maybe you can type it in the chat. Let me see.
Hi, can you all hear me now?
Yes.
Yes.
All right, awesome. Sorry about that. So basically, what my site does is it provides users with the daily updates on the amount of persons that have been tested, the deaths, those that are critical, and general persons in quarantine and isolation. It also gives users a basic understanding of what the coronavirus is, how it is transmitted. It also gives them signs and symptoms, and it provides them with basic information like how you should wash your hands. It also has a link to the global statistics, which is the total cases, the total deaths. It also provides users with a link to two self-tests, one of which the Ministry of Health provides. That's the one that I believe someone mentioned before. And it also gives them the information on a COVID-19 hotline. So if you click "Are you sick?", then it takes you to one of the self-tests, and it also gives you information on, depending on which region you're in, where you should call. And that's the basic gist of it. It's not too technical. It's just there to show persons what the daily statistics are, and where you should go and get tested, etc.
Can you guys hear me?
Yeah.
Yeah. So what's also interesting about your execution, Diopol, is the complementary social media posts that you have. Because I follow you, and I notice every time there's an update, you post it, and then you post the link to your site, which is, I think, it's a very effective strategy in terms of quick bites of information being fired off at the public. But looking at this, I think it's really visually appealing as well, which, it's much of the other solutions, of course, they focus on functionality, but I think you really created something aesthetic as well as informational here.
That's one of the major feedbacks that I've gotten. I've been trying to make in such a way that it sends persons updates whenever it sends persons a notification whenever the statistics change, so they could keep up to date instead of having to click on the website all the time.
Awesome. And have you built any analytics tracking inside of this? Are you tracking your daily visits?
I have. For last month, I've had over 10,000 unique visitors from all parts of the country, actually, which is kind of cool. And I've also gotten persons from the US, even Russia. I've had persons from the islands as well. I've also been working on trying to integrate a regional tracker where it gives persons the statistics on persons, islands in the Caribbean, and how many cases they have, how many deaths, and recovery rates as well. And I've also I'm almost complete with one that gives them the information on South America as well. And I've also tried to make it in such a way that they could choose whichever language, because we need to also think about the Spanish speakers that we have in our country as well.
Awesome. Any other questions, guys?
Yeah. I have one question. How are you hosting this now? Are you hosting it on a regular VPS or a self-hosted?
Regular VPS. We've been using name share, I believe.
Okay. And with regards to the data, are you exposing any APIs currently? Any of the data that you're capturing?
I had an API in place, but I can't use it because what I found was around 4:30 the ministry would issue a live stream where they would announce the stats for the day. However, on any other website, it wouldn't be updated right away. It would probably take about 30 minutes to an hour. So I had to disable the API, because basically what it did was scrape and then add the information on.
Okay.
Yeah, so
Understood.
yeah.
Okay. Thank you.
Hello.
Okay, so now you statically update the information on the site, essentially.
Yeah, basically.
Okay.
Right.
You must be paying attention to a lot of live streams then. Like,
It's a bit tedious, I must say.
yeah, I can imagine, man. But yeah, I love the visual appeal of this site, especially, and you know, we pull from a couple of APIs as well. So if there's if you are looking to have it, I understand you're trying to get it like regional as well. So we
Yeah.
do it. We already do it by the region through our app. So if you speak with either Dina or Jason, we can give you access to pull from the same API or help you
That would-
integrate that into your set.
That would be awesome. I'll be sure to message you.
Yeah.
Awesome. I see the different breakout teams already forming. So we need Karen. We need to take a look at your crisis management app. Any?
Is Julius there? Him as well?
Julius, are you ready for us? I guess we may have to circle back. So let me just ask across the board, does anyone have an initiative, a solution that they'd like to share with us right now?
Well, it's more of something that I've been working with someone on. It's it's more focused on food security, where basically what it will do is provide users with information. So when they select the region that they're in, provides them with information on soil type and types of crops that they can plant to help them maintain food security. And what it'll do is it'll also provide persons with a platform where they could display their produce as well.
Mhm.
So yeah, that's basically the gist of that one.
Okay, so it's just a concept right now, or do you have something tangible, something that we can take a look at?
It's more of a concept at this point. It's I'm still working on trying to put everything together.
Got it. Okay.
Yeah, I've written down kind of the different initiatives that we see here so far, and where they kind of. I definitely see they can have a breakout group with Tristan and the other guys in terms of looking at protecting the vulnerable from the education standpoint.
Yeah.
But we haven't seen Julius, but based on his description in it, I think what would be a key thing on there is if our group and his group and also Karen's group, from what I understand, the crisis management have to form some synergy in terms of the provision of resources, kind of vertical, with the way in which their solutions seem to be kind of implemented. Because there's a good amount of overlap in kind of the stuff that we're doing already, and if we can kind of try to center that into, I'm not saying like review anybody's app, but have one central data resource that we're all necessarily working from. And a key thing that Julius already has is if they're already getting ministry buying and they might have a few people already registered, then we can look at kind of exporting some of our modules to kind of their solution to better aid the cause as well.
Yeah, awesome. Yeah, absolutely. And yeah, we really got to start those conversations to see how far we move along together. So good. So at this particular point, I am opening the floor to any additional contributions, anything that you guys want to share coming into the hack solve. But like I mentioned before, we are in the initial segment of the hack solve, the COVID-19 virtual hack solve initiative, where because of the unique nature of this, we are taking a look at the initiatives that have already been worked on. So we give everyone an idea of what's out there so that we can foster synergies, collaborations, figure out a way to do some cross-pollination with regards to the solutions. The next natural step for us right now is to take a look at the problem set But we want to make sure that we get through all of the major presentations before we shift into the next phase of the hack solve. So, last call. What do you have to present?
You're making calls in terms of like initiatives that people have in mind, or just
Yeah, we're using the term initiatives to mean, actual early stage proofs of concept, implemented applications, etc. But when we get into the brainstorming session, we can talk about their concepts, their solution concepts.
okay. Well, I'll save my kind of comments for the brainstorming session.
All right. Kenita, are we going to see you guys present before we shift gears?
Okay, so I was just thinking to give the run through. So I'm gonna share my screen.
Great.
Just quick, does somebody have a fan on? Thank you.
Stop. All right, can you see my screen?
Yeah, yes, we can.
Mm-hmm.
Okay. All right, so this is the STEM Guyana's app. The name is Help Guyana. And this is the interface. You would put in your email address and a password, and then you sign in. Now, I'm using the app on a computer, but it also can be used on a phone. As you can see, it's very, very big. The Help Guyana app.
Is it me? Or did she just drop off? You guys are still there?
Yes, I'm here.
Yeah, I'm here, but can't
Oh,
see.
no. Yeah, Kenita just dropped off. Connection lost. 100% packet lost. Okay. Hopefully she circles back to us.
Yeah.
But in the meantime, let me ask you guys, what are your thoughts on what you've seen thus far? Generally.
Well, I like that there is a lot of variety in applications, and that's kind of nice.
Yeah. I thought there was going to be a lot of successive presentations that all are, carbon copies of one another. But the presentations that we've seen thus far have a lot of variety indeed, which is good. Don't get me wrong, there are overlaps that you guys know about, of course, that hopefully we'll be able to address in the next 48 hours. Okay. Julius, you ready for us?
Hi,
Or are you still driving?
I am getting myself organized.
All right.
Yeah, I think I am ready to go. Let me just
Okay,
pause
good.
this.
All right.
That's good.
1 minute.
Is it just me, but I still see Kavita's thing?
That's what I'm noticing. Let's
Share?
see, I think because she dropped off while sharing. So maybe Julius, if you share your screen, it'll hopefully reset the feed. Let's see.
Yeah.
It's good now?
I don't know, well, I'm guessing you're seeing my screen.
Yes.
Yeah.
Go ahead.
Okay. All right, so just gonna give a demo of the app right now.
So tell us the genesis of this, Julius. How did this come about? What were you guys thinking of? You know,
It basically started from one of our our colleagues that we have an Apex Guyana group, and one of the guys in there, he said, "Hey, why don't we like do a little volunteer project for um, you know to assist the Ministry of Health to track COVID because there was nothing available at the time, that at least nothing public that we knew about." So he pitched the idea to one of the regional health officers, and he said, "Okay, sounds like a good plan." And they were inclined to give us the go ahead because, of course, it was free. It's a volunteer app, so no cost to them. So that kind of made it a lot easier. And from there, we just got together. I think we started off with the current physical forms that they were using for collecting the hotline information, and as well as the other pieces of data that they collected, and then we just started building from there. And yep, and here we are right now. So that's how it started. Yeah.
awesome. And what was the build time from the inception to delivery?
We were ready to go, like, to launch, go public within about, I think, a week and a half.
Okay. Yes. Power of it.
But there was, of course, yeah, but there was a lot of you know, the decision makers usually have a lot of things holding them back from saying yes, we're ready to go live. So that was one of the reasons for the delay. But we were ready. We were ready to go from a long time ago, long before the app was out publicly.
I don't want to jump ahead before you go into stuff. So is this application is currently being used, if I'm correct, right?
Yeah, you're correct.
But so how many people do you guys have signed up already?
We've got about close to 800 signups last I checked. But that was initially the plan was to do to have persons sign in to access all of the services, but we eventually changed that decision to have more public services available. What in the world is that?
Right.
Yeah, sorry. Origin has this thing where it just keeps popping up on my screen, and I don't know why, so I always have to just give it. Yeah. Anyways, yeah, so we moved away from having the services behind a login to having them more public, and that has actually seen more use than the login sections. Of course, you can still log in and use the features as well, but public is better, or public has been getting a better response.
Yeah, of course.
So can you show me, Alex? So what can you do from a public standpoint, and what can you do from having a profile that you logged into? If you can just show us that.
Sure. Yeah, I'm gonna just do that since I'm on the home page. Well, of course, when you access the app, the home page, you get immediate access to the services that we have at the moment. There's some COVID-19 quick tips, and then there's a summary of the stats that we collect at the bottom of the page. The first section is hotline numbers. This started off as just a few, but then they eventually added like hotline information for all the regions. So we make it easy to access data from a particular region that you might be in, and of course, with the way browsers have evolved now, you can of course click and dial right from within the app. So if you're using it on a phone, you don't need to open a separate app to dial a number. It's convenience. The big or the most popular thing is the self-screening tool. So I am just gonna fill that out.
But Julius, are you
Go ahead.
demonstrating it? Because it looks as though your
We're seeing
screen,
one screen.
your
Oh,
screen isn't showing us what you're talking about.
oh, what is going on? Where do you see? All right, let me retry this.
So if you scroll over one of the participants' images, the top left, it shows the bit rate. So from time to time, Julius, your bit rate has been dropping. No fault of yours.
Uh-huh.
So that is what happened there.
Okay. All right. So what do you guys see right now? You should be seeing self-screening.
It's still coming.
Nothing.
Hasn't popped it into nothing as yet. You see an icon of a computer screen.
Yes.
Yeah. So Julius, I think you have anything else running doing internet, you should kind of close it off, because when I roll my mouse over your image,
Julius is off though.
right, it shows your upload speed to like be 38 kilobits and your download speed to be 306. So I assume that is why we cannot see your screen properly.
All right. Technical difficulties. All right, let me see what's up.
Ellen,
Uh-huh.
at some point, we have to have a discussion on the importance of internet exchange points throughout Guyana and the importance of caching servers in different parts of Guyana. As part of this discussion. So when we get there, that's one of the things I really want to address.
Yeah, certainly. Anything, Julius?
I cannot see any particular issues right now.
Let me see if I can just try
Things
to.
seems
I'll share
okay
my
on my end.
You guys let me know if you see anything.
Yeah,
You can see your screen just fine.
You can see, okay. All right, let me turn back to this. I'll stop. All right, try again.
Kenneth is back, by the way.
Oh,
great. What happened just now?
I have no idea.
That's Murphy's Law.
I think it was an internet problem, though.
a kind of quick question is good. Ellen probably ask persons which areas they are and who are the internet providers, and see if there is a correlation.
You wanna fill the silence by doing that now?
Alright, so
GT&T.
I have
just check it out.
It's
confirm you
GT&T.
received the message.
I have no problem. No, Ryan. Let's do this scientifically. Let's not make no assumptions. We don't know for sure. Ellen, what who is your internet provider?
GTT.
Okay. Julius, who's your internet provider?
GTT
What is your location, Julius?
and more East Coast.
Okay. Eldon, what is your location, please?
Southern Belt.
Okay, great. So we know East Coast is given an issue. Kanita, what is your location?
Albertown,
Good. And who's your internet provider?
GTT.
Okay. Thank you very much. We really appreciate it. Chris, I will not ask you. I would ask you.
I was just afraid you asked me.
So the question, are you still experiencing issues with sharing your screen?
Yeah, I mean, I don't see anything like on my end that is like the issue. So
Do you
I'm
have
not even
like
sure.
multiple monitors or something?
No, just one.
No. Because I mean, let's work with the data. When I roll my mouse over Julia's screen and I see his bit rate, and I compare it to Ellen's, it's a clear difference.
Well, for the sake of time, can we have Kanita just continue with her presentation, and we can hopefully by the time
Hopefully.
get through to you, Julia.
Yeah.
Fingers crossed. All right.
Can you see my screen?
Yes.
Okay, great. Yeah, so I was taking you through the app. We were at delivery and news. There's also a donate button where persons can donate money. We have a marketplace. Volunteers can sign up to help, and also security. Now I'm going to start with the marketplace because this is where our businesses come in. So persons can upload a picture of the product that they have to sell. They also give the price of it, their contact information, and where they are. So we have some persons in region 4. We also have some ducklings selling. And then we have the images. Now, so these images would be helping us to, see what is it that we're buying. Just a second. Yes, so you also, if you see something that you want, you can request it, and those items that you request would show up. This is also the interface where you can actually post what you want. Okay, so that's it for marketplace. For news, we're hoping.
So before you move on from marketplace, I'm just trying to wrap my mind around the concept. So persons can actually browse the inventory and marketplace and create sort of their needs request from that.
Yes, they can.
Or is it that it's actually linked to merchants?
I think it's actually linked to merchants, from my understanding.
Is it that it's actually
linked to merchants? So the merchants.
I think it's linked to merchants. So like, yeah. So if let's say we want landscaping, you press it and then you request it.
Okay. So if I want groceries, I come to the app and I go to marketplace and I choose the groceries that I want. And I can order it. Okay. Got it.
Yeah.
Okay.
All right. So you can request, not necessarily order.
Pardon?
So you can request, but not necessarily order, right?
You can request, but that request would lead to an order once you call the person and you make contact with that person.
Yeah, just trying to make sure.
Yeah.
Yeah, our accepted version of order, given that we don't have online payment methods that we can really integrate yet. Sadly.
Yeah. And then this is because it's COVID-19, so the app is actually a crisis management app. So it's not only for COVID-19. Like if Guyana has a flood, right, it would be crafted to that. So because it's COVID-19 and mask is one of the main things that people want, there's a special feature to register your mask and locate where masks are. So this is the interface for that. You can also register persons who are at risk, right? So if you're at risk or if anybody's at risk, you can do that. And this is the interface. You choose the person's region, where they are, registered household. I think Miss K, yes. So within 14 days, they'll be able to, get onto that person and see the person's needs. There's delivery. So that's basically what the app is about. It is sponsored by STEM Guyana, Coily, and GTT and Epology. So, and it's an all girls app.
Okay.
So,
Could you go back
yes.
to delivery for me real quick?
Delivery?
Yeah.
1 second. Mm-hmm.
Okay, so tell me a bit about that. So do you index existing delivery services in Georgetown?
Well, this interface is basically if I'm the person that is doing a delivery or can offer a delivery service, I would put in my name, put in my region,
Oh,
how I deliver, and then I would register my service. So it's
okay.
basically whoever is the person that signed up, they're the persons that are, making whatever services that they have available for people.
I see.
Yes. So it's not really the provider or the person who's doing the app putting in all the information. Whoever signed up, they're, saying what they have to offer for people of Guyana.
So how does let's say a regular consumer, if they want to order something from Marketplace and have it delivered, how do they use your app to do that? I'll use air quotes. Yeah, go ahead.
Well, that from my understanding, that would be done based on the person's contact information. So whatever you order, let's say it's pineapples, right? The person's contact information, when you contact them, you say, okay, how am I going to get it? If it's something that the person said they can bring it to you, they bring it to you, or they meet it at a special place. So it's all based on the provider and not necessarily,
So it's pretty much connecting those with products to those who need products and services.
Yes, exactly.
Got it. Okay. Any other questions, guys? Any other questions? Or did I ask them all?
Oh, there's also a profile, so you can see my profile. This is actually my profile here. And this is what I was looking for, my request. I didn't make any requests, but this is where you would get to see all the list of things that you probably asked for, and you're waiting to be contacted on it. And well, I posted these items to sell because I kind of do some kind of jewelry stuff. So yes.
Nice.
Miss Karen would have been the better person to deliver, but
that's fine.
unfortunately.
No, this is informative. I like the initiative to address the kind of the economic tools that the crisis is implying, right?
Yes. Yeah.
Because I always, when I think about the situation, particularly we have in Guyana, in that, poverty might hit faster than a medical crisis.
Mm-hmm.
Yeah. I think in one of her previous presentations, is really targeting those at-risk communities. And I think information on them is critical now because a lot of them would have been daily wage earners in Guyana.
Yeah.
And they are home having no food, there's no set stimulus package as it stands now. So finding a way to catch the hand, as they say, would be critical.
Indeed.
Yeah, have you guys taken a look at Facebook Marketplace lately? Because I've seen a lot of that. So what was actually identified by STEM Guyana's app is pretty much trending right now. I mean, a lot of persons are posting on simple things like right now, home gardening is trending.
Yeah.
Other persons are resorting to resuscitate or at least enhance their home gardens. So there's been a lot of listings on Marketplace, based on what I've noticed, of landscape persons and persons who sell saplings and seedlings and whatnot. So,
Yeah, and I'm thinking
really relevant now.
just what I've been seeing from the solutions presented so far. I think one way we can really have a discussion on them is how we can help when it comes to an adoption strategy. So like we have a lot of these initiatives that are necessarily started out, and as you would have seen, some of these things would have gotten like a one news article, and then from that from that initial peak of say people just clicking onto this, there's definitely a drop down. And I think with necessarily the resources that we have and the capability that we have, we can provide some form of crucial support to kind of have people think post when you release this, because that when you launch it is when truly the challenges start, right? I mean, we have all of these beautiful things, and can we truly say that people are fully utilizing it to its capabilities at its current moment? Right? Probably not, since we're now discovering it just from ourselves, right? So I think one part of it can kind of be the end part is how can we provide support from like our Nexus 7 V75 Inc. can help in these projects ensure that they stand the test of time.
Good point.
Yeah, absolutely.
Chris, can I would like to throw something in. Let's look at this from a number standpoint. There are 420,000 Guyanese who have some form of social media account. There's 110,000 of them on Instagram, about 30 to 40,000 of them on Twitter. Yeah.
How do you know all these numbers?
No, come. Let me keep it rolling. So, given that for the last couple of years, we have finally gone. Internet penetration has gone over 50% nationally, with a year-on-year change of 5 to 10% in increased IP addresses registered in Guyana, which means new devices that require IP, whether it be a cell phone all the way up to a computer. All right, let's not go into the disaggregation just yet. What is clear, following what you're saying, is that for all these apps and initiatives to really make sense, including yours, there must be a better way rather than an article and a Facebook post to get it out to people. And I think involving the telecommunication players is very key. Is one. Two, the regulatory standpoint is also key, because I happen to sit on the disaster response board for the Association for Caribbean Telecoms, of which the two predominantly big Guyanese telecoms are part of. And what is becoming clear from a regulatory standpoint is that for ICT solutions to survive, if they are not well driven by the provider of the pipe, social media alone is really not going to drive this. Yeah. So I think part of this conversation, I don't know, Ellen, if you invited them to be part of this. I know the IDB is part of it, but the telecom providers should be key and part of this. Why I say this? Google and Apple have united for COVID-19. So I really don't see any reason why two big companies cannot collaborate on such a critical thing to the livelihoods of.
So you mean, I just want to clarify. So you mean their involvement in terms of, their delivery of service being far-ranging than it is, or helping in the driving of these products?
Right.
Okay.
So let me give you a direct example. We have Julius app. We have the young man app. We have stuff that you're doing, etc. Most of the users, I listened to the line of questions yourself and Ella would have asked, like how many users was the average number of people, and to me it seems that um, the user base seems to be very small. And as we collaborate and we synergize, I think the next step coming out of that is say, hey, telecom person, you and you're over 400 something subscribers, or you with your 200 something subscribers, can you send out a blast? Or whether by the ministry or the national COVID task force, whoever is the initiator is irrelevant to me. What is key is that the persons that have the ability to drive the user uptake of these applications that are critical to looking at the data and future planning is the telecoms, because they have access
Duly
to
noted.
everyone.
Duly noted. I agree. But let's dive deeper into this particular topic in the latest segment. We definitely have to bring that up, particularly relevant. But let's wrap up this segment by hopefully getting Julius to present, and then we'll jump into the introduction of co-acting as a platform. So Julius, hopefully everything is functional on your end. You want to take a
Yeah, hopefully.
try
Let's see
sharing?
if it works.
Yes.
I'll tell them. I think Samantha's popped up now. So
I'm actually back, guys.
Awesome.
I
Good.
post the stuff in the chat though. I have some more stuff that I'm gonna post.
Okay.
so
Great.
you don't want to present?
I would love to present, but the internet here is very choppy. That's my problem right now.
Agree, you
So
want to ask a
there is
question?
someone else. There is someone else. By the name of Clement. I asked to present. So if um all doesn't go well on my side, Clement can actually do the first one. And I actually
Great.
have two more that I wanted to present.
Great. So as soon
Okay.
as Julius is through, we'll have Clement and team.
No problem.
Yeah. Thanks so much. All right, Julius, go ahead.
All right, so are you guys seeing my screen? I have to ask.
Yes.
Yeah, we're seeing your screen. We're seeing COVID-19.
Okay.
You got to confirm the screen that you think we're seeing. Yeah.
All right, good. That's good. That's good. All right, so I'm gonna just go back to the first one. Right. So this is the homepage that I was describing, thinking that you could see it, but you couldn't see it. So yes, as I was mentioning, the first thing available is the quick access to the hotline numbers. Wow, my internet is really slow today. And of course, we've got them organized by region and easy access dialing by just a tap or a click. So if you're on a mobile, you don't have to open up a separate dialer to access them. Nothing fancy, but convenient. The second and most popular thing right now is the self-screening tool. And of course, there's a little disclaimer at the top to advise people that if you're coming to use this, but you're experiencing these symptoms, it means that you're having an emergency, and doing a self-screening isn't going to help you. So you should immediately get medical attention. But if you don't fall into that category and you wish to proceed, we go through the questions and give you your assessment at the end of it. So I am going to go through it. This is not my first time using SelfCheck. I have not traveled out of Canada in the last 6 weeks. I'm not in isolation. Yes, I did come in contact with someone with a cough. Um, were they positive? I don't know. And I can add any information Any contact info for that person here? And then it asks me if I have any symptoms. I'll say yes. I have a cough. It started today. Do I suffer from any preconditions? Preconditions would be diseases that make or illnesses that make you more susceptible to serious complications. No, I don't have any of those. And I'm going to get my results at the end of it. So, because of my results, it says that I should be under weekly surveillance. That is, that the health authorities should be contacting me on a weekly basis to follow up on my condition to see if my symptoms progress to the point where they think I should be tested, and then they'll make arrangements for that. But of course, they need to be able to contact me for that information. So this is where we now ask the person to submit their contact information. Because of course, otherwise, we don't really need to contact you if you're healthy and fine. But if you do fall into this category, then you submit the information, and whatever information is collected here, it shows up on a dashboard that the persons in charge of surveillance can access. So they've got all the relevant information about your self-screening, as well as whatever other stats we could get them based on a compilation of all the self-screening results. Any questions about this?
I have data questions. So can you tell me like how many self-screening tests do you guys get on average?
We have about so far about 380 self-screenings done.
Right. And you can confirm that this goes already directly to the health authorities?
Yes, goes and is followed up. Like I was saying before when I was just doing audio alone, they follow it up relatively well and in a timely manner. So it's actually, I can say, something that's been working fairly well.
Right. So I already see an alignment here in terms of this. So what I really like is the fact that you guys already have essentially people that are hopefully monitoring this, right? And in our virtual assistant, right, we have essentially the same thing. Might not collect as much of this information, but what I think, given that we can be a little more penetrative in terms of getting access to people who don't have a web access. For instance, like they can call and talk to our agent, and they can also text to it. What I think, just getting into this straight away, is if we could be able to kind of tap into yours and send you assessments that we're already getting through, let's say, an API that you can then look at.
Yep,
So that's one thing
sounds like something that is doable.
Yeah. So I like that already. So proceed.
Okay. All right.
Well, there's this momentary. We've got around 7 minutes until our 1 hour stream time is up, and then we'll have to resume after that with a new link. FYI.
Okay. Good to know. All right. So in addition to the self-screening page, we've got a page that just gives basic information about COVID. Just for persons who might be looking for something reliable through all the noise that we get. Just keep it very, very simple. Not more than 2 sentences in any of the areas here, because people have very short attention spans. Basic symptom information, tips on prevention. Again, not just keeping it as simple as possible, and frequently asked questions section, which has a bit more info, but again, generally short and easily understandable. And then we've got the statistics section the statistics that we are allowed to share, because there's more that we can share, obviously. Um, so we've got new cases by day, by week, um, graphs tracking cases throughout from the first day that we had the first confirmation. So today,
So,
you've got comparisons. Yeah, we've got a lot of stuff happening here.
another quick question. So, does the ministry currently maintain their statistics using your platform?
They provide us with the stats, and we keep it in sync. We keep ours and theirs in sync.
I see. Okay, so they
But
don't
the eventual of
essentially
them,
they don't
yeah.
essentially use your platform to like register the people
Um,
and update their, so like imagine there's a patient that they create inside of the system, and then a doctor would go and say this person has switched into a critical condition, and then this automatically is updated by your app. I'm guessing the flow now is that at the end of the day they give you some information and then you guys update it.
yeah, that's the flow currently. But like I was mentioning earlier, we do have the facilities in the app for all of that, from
But they
the
but they
entire
just don't want
patient
to
care suite,
adopt
everything.
it.
But these things take time to get sorted out, unfortunately. And I gotta say this, just being open, that a lot of things could be done a lot faster, but our decision makers have some amount of apprehension with technology still, and
All
they
right,
are
what about
generally quite slow in making in making decisions when it comes to adopting technology. Generally slow, especially this entire app has been an example of that. Like I said, we've been churning stuff out rapidly, like way faster than usual, but they're just fairly slow in their adoption. And
So I think going into this, Alan, this is where we can provide support from our end by
We should put this as one of
making,
the problems on the canvas.
yeah, and just start them.
This is a special problem that hopefully we can shed some light on. So,
I
yeah.
agree.
yeah. All right. So in addition to this, that is it for public access. So persons with an account have access to this symptom tracker. So the idea was that the persons who are on surveillance, instead of having to call the healthcare worker to provide them with their information and that of their families on a daily basis, they can input the information directly within the app. And again, this information is visible and available to the persons who are in charge of surveillance. So you would fill in your information about your family, your location. That's where I am right now. Um, you would add in information about your family members. Oops, I'm logged out. 1 sec.
So Julius, just over a minute left. What I'll ask is that our viewers
All
look
right,
out
we'll
for
pause
our
here.
updated live stream link,
Uh-huh.
and we'll have to reboot the stream itself. So just wherever you are, just pause. Look out for a live stream link in the next minute or so, and then we'll pick it up
Okay.
from. All right.
When you get it, just send it to me.
Zoom.
Is on.
Have I what?
So we're back. So Julius was presenting on his tool. So 1 second, Chris. Let me get you this link.
Yeah, what you were saying, Agri?
Go ahead.
Okay. By go ahead, you mean resume?
Yes.
Okay. Yes.
Chris and Roger
Yes,
can
so-
chat afterwards.
I was
Julius.
yeah, I was displaying or demoing the symptom tracker. Uh, so this is the tool that individuals would use to track their family's conditions throughout the isolation period, and this is what the authorities as well would be using to follow up. In case they see person's symptoms getting worse and determine, all right, you definitely seem as if you're positive, so we need to test you. So, oops, sorry. Right. So once we've got our family member there, we can then update the symptoms. No chills, no vomiting, mild abdominal pain, mild sore throat, mild headache, and mild fever. So when I save that, based on my answers and the particular symptoms, it gives me a score. The 17 is basically saying that out of the total, I think percentage, this is percentage, yeah, it's percentage 70% chance that I am infected with COVID based on my responses. And we also color code it to make it easier to understand, I guess, for the person submitting the information. We've built in a little bit of logic into it. So if you can edit it like immediately after, but after, let's say, about an hour, you're prevented from actually updating this information. You'll have to add a new record. So let me update a few of these. Say severe. So I updated the severe, and my score was up, and it's highlighted a bit more. So the individuals would usually go through this process on a daily basis because they would have to do this over the phone, and it allows, again, the authorities to track the health of the person in isolation using a relatively simple method. And all of this data, the data from the symptom tracker, the hotline that the call agents fill in, the public self-check, as well as the self-check from here, it's all aggregated. We plot it on graphs. We divide it into suspected cases and probable cases, and the authorities have access to all of this information, to help to guide them on where they should, like, for example, when it comes to deploying the mobile testing units, that is the kind of data that they can use now to make that decision. Yep. I think that's generally the app for the most part. So yeah, any questions?
Yeah, you're making mention of the facilities that you guys have in place for them to input patients and track that. Is that something that you can show, or yes, I guess?
No, I cannot show that part.
Okay. All right.
Anything else? Anything that I haven't shown is because I can't show it. But yeah, there's a lot more.
All right. Well, yeah, this is good. I mean, I definitely see one of the big breakout groups being our team with Dinard and Jason, especially since both of these are Apex applications, so it should be a light good in terms of combining kind of the efforts. Because I mean, if you guys already have people sort of updating information, right? I like the entire health check. One of the three verticals that we wanted to get out of this hack solve is looking at the economic factors as well. So what would be good is to incorporate the parts of our application whereby we track such as the resource logging, and just have it be like one information group by people, one portal whereby a person come and give their symptom tracking updates, as well as giving kind of their economic standpoint, right? So while one set of information is being forwarded to the relevant health authorities, the next set of information can be forwarded to the people who are interested in providing relief and services. Have it all just come through one sort of portal. Yeah.
Any other questions or comments for Julius? Oh, we'll definitely have a deep dive, Julius.
Okay.
Hi,
All right.
I have a
I do
question.
have. Go ahead, Agar.
Do you have a API available now or no?
Not exactly. As in, when I say that, I mean don't have any issues with making the public stats available via API. That's fine, but we just haven't done it as yet. So
Okay, good.
yeah. There is one more thing I would like to share though. It is kind of it's similar to something the app that D-Not had demoed earlier. I guess this is one of the reasons why we do have this entire event, so that we can see what everybody else is working on.
Mhm.
So we're actually building a second application, and I'll tell you why we're doing it again. Is because there's been general sloth in the decision makers when it comes to adopting stuff. So we have been behind quite a few persons for maybe close to a month, 3 weeks to a month, to start doing some additional data collection, and they haven't even taken the time to follow through on it. So we decided it's better to take another approach with this thing, because again, the idea is to help people who are vulnerable. So we've started building another application with the aim of providing 3 functions. Again, it's very similar to something you guys are doing, and that is to let persons who are in need let others know, to manage persons who have donations to make, and thirdly, to help people who distribute. So just gonna pull it up now. So this is it. It's called Care GUI, or Care.GUI, however you wish to pronounce it. And that's the general idea that we had behind it, because again, there's lots of different groups who are doing distribution of resources. As was mentioned by, I think it was Christopher was saying it, we also recognize the problem that what is actually guiding people to make a decision on where should get aid. And the reality is that it's just being based on anecdotal historical information.
Yeah, outdated information.
Yeah, and even the prime minister said that they're using data from the census, which is not very,
Oh,
very
don't get me
accurate.
started on the census
So I
data and
mean,
how
like
inaccurate it is.
that is like from way back when. So just those combination of things, we thought, this is something that needs to be done like yesterday, and we need to get it out there. So we just decided to start building it and to make it available to the other groups who are doing distribution of resources. Um, for persons who are in need of help, they fill out a simple form. We just collect pertinent information from them: uh, name, persons in household, contact information, location, what items they are in need of. If they need financial assistance, what do they need it for? Do they have current supplies? How long do they think it's going to last? when we're providing them with food or items, are there any allergies we should know about? Do they not eat something? Is there anybody who needs regular medical care? Are there persons with disabilities? So that's the kind of information that we collect from the persons. And the thing is that it doesn't necessarily have to be that person who's filling this out. Anybody can fill it out. And again, it's public, so there's no login required. The personal information, though, that will only be made available to the individuals or the organization who has indicated that they would like to take care of this person. So they have a section within the app that they use to say, okay, we've got these 5 families in Golden Grove, or we can handle these 5, and they will take care of them and provide feedback on that distribution and on how it went. So again, the idea is just to get the help to the people who actually need it. I think that's the slogan, linking those who need help with those who can give help. I think something like that. But yeah, that's generally the direction that we're heading in with this. So yeah.
Yeah, that's really admirable work, Julius. And again, there are a lot of synergies that we can definitely look forward to because, well, Chris would know the system that we were developing behind the scenes as well had certain overlaps with this. But without a doubt, it's definitely needed, and it'll be good to put this on the board as well. Now, how far away are you from deploying this?
I would say we've got the only area that needs a bit of work is our public, well, not public, but just our general stats section, and we need to polish up the donation section, and we're pretty much ready to go after that.
Okay.
I have a question.
Go ahead.
What kind of donations are they? Financial or strictly things, products, perishables, non-perishables?
There's no like restriction, but we would preferably. I think people right now would need. Well, the thing is, that if I say that, I would be judging based on not on data. So really and truly, at the moment, we are collecting the information, and based on what is collected,
right,
we would then decide, are we going to open up a section for financial donations? But I really would tend to stay away from that because you would really need the organizations who already do it to manage that kind of thing. So we would just collect the information, and they would have it available to see what the current financial needs are. But I think our focus would mainly be food and household items.
Okay.
Yeah, and medical items as well. To some extent, not prescription medication, of course. Because that's different as well.
Well, that leads me to my second question. Have you put in there persons who are on medication and one not working, and because they're not working, they cannot buy the medication, whether it be diabetic patients, etc.
Yeah, well, based on the data that we're collecting, we can be able to provide to get a picture of that, whether there are persons who have a need for medication and they also have a financial need. So those two things would say, okay, this person is in dire need, especially if they are also a person with a disability, or there are persons with disabilities within the household, and that they also have a medical need. So that's the kind of overall picture that we're trying to get of the vulnerable person society.
Okay, excellent.
would it be linked to a hotline by chance? Because chances are somebody who's in need might not have an internet connection.
Uh, would it be linked to a hotline?
Yeah.
We can facilitate that. That would respond to it. Because it's essentially just form filling.
Yeah.
What I'm looking at,
Yeah, pretty much.
particularly Eldon, is their decision to not necessarily tie it to an account, right? And I'm just thinking off my head how the adoption rate kind of will work in
Those
that
are very
case.
valid questions, and there are other things that we can dive into to assist Julius and team in terms of making this execution that is just providing other perspectives. Another thing that we could probably generally throw out there is figuring out a way for us to, based on Paul's question just now, how do we get a conversational layer on top of these services so persons can call in right, and still
Yeah,
use
that
it?
would be useful, definitely.
Yeah.
That would be useful.
So let's definitely have those conversations. Julius, do you have anything else to share with us?
No. The others are just not ready for prime time as yet.
All right.
It doesn't have to be ready for prime time.
Great stuff. We'll get him out of him before the end of that.
you got all these things hiding on the rock, man. I mean, we're guilty of the same as well.
Yeah.
But yeah, we definitely.
One of our biggest hindrances as you know, the youth in Guyana is that we're overly modest, and that holds us back. So we've got to figure out a way to change that. Samantha and team, yes, you guys ready?
Hi, Clement.
Hi, I'm actually here. Good afternoon, everyone.
Hey.
So I'm on my phone actually. I'm not in front of a laptop. I will not be able to share my screen. However, the stuff that we have is from it's just a small group that we have here. It's something like, I can't remember the guy name. It's something similar that he have. But this one that we have is basically, it's a messenger something. Samantha did post the link inside.
I post the link inside the group chat, and it has one link to the messenger bot, and it has another to the platform as well, and it's the COVID-19 bot.
Okay.
So what it basically does is provide information
So
on
if you guys
cases.
want, I can open it up and share
Yeah.
my
Yeah,
screen, and you can
go
see.
ahead, Chris. You can do that. It will be better.
I was just gonna do that, but yeah.
Let me try. I just remember I got. Oh, I can change it to a window. There we go. All right. You guys can see my screen.
Yeah, we can see. Oh, not this one. I think it's not this one. Did you see the last one that I posted?
The last one.
COVID cases are GA. This.
Yeah. You could click on the messenger one. That'd be.
Okay. All right.
Click on get started.
Yeah.
All right.
And at the bottom, you will well, you can go ahead, Samantha.
No, go ahead, Samet. Go ahead.
So at the bottom there, you will see all the available option that is available to you. If you select news, basically it will bring up different news option, BBC World News, local news, and so forth.
Okay, in the form of okay.
For instance, also, well, basically, if you click on any news, it will give you stream on what the corona is all about. Yes.
Okay. Yeah.
If
So is
also
it,
if you click, go ahead,
no, I was gonna ask, is it purely button based? Can I like type the question and ask it and it gives me the information?
Samantha.
You have to you it's actually auto responsive. So the options that you give that is at the bottom, when you click those options, that is what it would provide. Those are the information it would provide.
And
So
also
like,
accurate.
go ahead.
It will be accurate information also that it will be pulling.
Okay. Yeah.
If you click on the country status, I think yes, it will give you the entire total amount of that the cases around the world, and it also will give you the option to select various countries.
Okay. Okay. All right. This is good. This is good. Good. Is there
Is
anything else
there,
specifically you want us to show?
Samantha?
Yeah, thank you. You can probably click on the others, which are like treatments, and it basically provides some like basic information um, on treatments and stuff that you can do to protect yourself, basically. And there are some other options where you can protect yourself. You have some mythbusters, and the end of it have who are like the contributors and so forth. Um, so those are some stuff that you can definitely capitalize on.
Okay. Nice. 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 It reminds me a lot of the WHO bot that they released on WhatsApp.
Yeah.
I think these are the exact same. Yeah.
We had
Nice.
another one which actually give a visual representation of COVID-19 cases, but I'm not getting to the young man right now, and the link for some reason is not
Mm,
showing the actual cases on the geographical location.
okay. That was this one.
Yeah, this one here is the same thing, right? But it's actually giving the map, and this data is actually pulling from WHO site. And I think there is also uh, DPI, or a local
Mhm.
news agency. So whenever a case or whenever something comes up with COVID-19, you can always like check for the updates here.
Okay. Nice. Nice. All right. Looks good. Looks good. Anything else, Samantha?
I think that's pretty much about it. Um,
All right. All right. Good stuff. There's definitely in terms of the digital systems. I think in the case of, since like our application and yours that you presented here, they're both information outlets. So I'm perfectly fine with them they having being multiple sources, because different places people can go to get as much information as possible. All right. One thing I would ask is, have you guys spoken? Because we've kind of been engaged with the NTTF. Have you guys been engaged with any of the government agencies to kind of localize the information that is presented? Hello.
Did we lose Samantha again?
hello,
Okay.
hello. Are you
Cheers.
guys here?
Yeah.
Yeah.
Yeah. I hear.
We haven't been able to speak to anyone or get anyone to talk to because I'm trying on my end, and some of the other persons are trying on their end to get persons to communicate with us to find out what are some of the challenges. But we had some think tanks, and we had a few other surveys that we were actually sharing to get an idea of some of the other challenges that is happening around. And some of the things that came out of that is that business is being affected and there are a lot more other stuff. And I think your survey would have definitely grasped more than probably what we have got out of our survey. Um, so that's it when it comes to this. Currently, we have a management app that we're working on as well, and a delivery management app. One of our challenges right now is the payment platform and what is available.
Yeah,
Because it seems to me that the well, you're getting to engage more with like the private sector and businesses because there is a need for persons to stay home, social distancing, and obviously we have to have some type of services that is there to provide goods and services continuously to consumers, right? And one of the challenges is the payment. I know we would have had some time back problems with online payment, and there was some policy or something that was supposed to be passed. I'm not sure if that is passed, but I'm still wondering what is the possibility of GTNT giving us developers access to their payment gateway so that maybe we can have a coin as well too that can work with the businesses or the organization that we are working with, because most of the times the payments are done right now based on um, you connect to the app and the person goes to the location to pick up whatever goods and item, and then it takes it to the customer and then bring it back to the business, right? So the business basically have to have a designated driver. It can be like a driver that is within the area that might need probably another opportunity or an opportunity to earn as well, and then you save gas and all these things. So you just have to drive from all the way to town to come down to the East Coast to get that done. Whereas you could have had somebody within the area do that, right? So payment is right now without no doubt one of the biggest challenges we are facing. And I think as developers, maybe we can come together and make a call for this those policy to be passed speedily, because I believe that if we are able to overcome that, a lot of young persons that are online can find employment online, one, and they can be paid nicely, handsomely, and they can also have don't have the problem where they can purchase stuff online sometimes, because sometimes when you have to use some of these cards that we have locally, you're always getting problems with the bank shutting your card down. So if a customer want to purchase online or they want to practice social distancing, right, and these institutions are not also being friendly with allowing those things, that's gonna be sort of a challenge. Yeah.
Question:
I,
is that a
I'm
policy
totally
that
agree.
allows PayPal to deposit money directly into the bank accounts locally?
Yes. Yes.
Oh, yeah. Yeah, that's been an issue for quite some time.
I think we were blacklisted or something like that, and it caused that to happen. And then I don't know, we went into the gray list, and I'm not sure what's happening.
I
No, I don't think it's a
Oh,
blacklisting issue.
it's
yeah,
actually
this is another very relevant issue that we should throw on the canvas. And we can, I mean, it's a great thing that, I mean, looking at all the presentations across the board and understanding, how you guys are operating and the types of issues that you're raising, this forum is turning out to be something particularly significant in terms of shifting how we do things from now on, or at least having the potential to do so. And I'm really pleased that everyone's connected on Slack right now, so we can create specific channels. For instance, a specific channel, right? Just to discuss ways in which we can look at what we have to work with and then find avenues to alleviate these hindrances that we have. So definitely we need to canvas this as well. As it stands right now, I'm going to ask if anyone else has anything else that you'd like to present. If not, then we can shift right into just unveiling the canvas to you guys, and then we can wrap up this segment. And have our virtual snacks, of course. Yeah. So anything else? All right. So I am going to share my screen really quickly. You guys would have seen the handbook where we have where we've linked this co-acting tool. So as mentioned, let me know if you can see my screen. Can you see it?
Yep.
All right. So
we can.
good. So when we were preparing for this this virtual HackSolve initiative, we first sent out a survey. We collected hundreds of responses. We've distilled those responses because many of them kind of overlap into 51 reported problems across the communities of Guyana, persons who would responded to our survey and our Facebook posts. And the guys whipped up this particular platform in under a week. We pretty much rebuilt it. It's rough, but it's functional right now, hopefully, fingers crossed, to kickstart the HackSolve and then keep our efforts going in a coordinated manner. So I just want to take a moment, 5-10 minutes, to just introduce it, take you through it, and I'll just leave you to register on it, and then we can resume and identify those focus groups, which will be our breakout teams. And we can create our Slack channels and then begin the actual brainstorming analysis based on the problem areas that we're most interested in solving. So the idea with co-acting, like I mentioned, it was a product of our first HackSolve. And it's really a platform to coordinate problem solving and community-driven initiatives. The concept is really simple right now. We further simplified it. It begins with an array of problems. So the problem canvas that you see down here is populated by all of the problems that we grabbed from our survey. The general public is able to continuously add to this problem canvas. So of course, it goes to a moderation queue so that we won't promote garbage to the canvas, because there may be bots there, or persons might post things that might not be appropriate. So there's a moderation queue, and then once a problem is valid, then we promote it to the canvas. But the purpose of this canvas is to highlight what problem areas are available to be solved, who is actually working on which problem area, and what initiatives there are in the mix. So this particular canvas is our first cut, which shows just down at the bottom here how many initiatives are associated to address the problem in question. And you can click on a problem to get more details about it, and there are tags that allow you to further filter a problem based on whether it's related to healthcare, education, things like that. And then of course, persons can comment on problems to further feed information back into the system so that they can inspire initiatives, etc. The other aspect of this is the initiatives page, and this is where you guys come in. So many of the presentations that we just saw can be turned into initiative posts. So an initiative is pretty much a response to a problem. It can be a conceptual solution, or it can be an actual proof of concept or an implemented full-fledged production-ready solution, for instance. And this is where you come in to post your initiatives, so that when you post your initiative, we associate it with problems. So whenever we are feeling like the public spirited persons that we are, and we want to solve something, we head to the canvas, and then we identify, okay, well, he's doing that. Maybe I can help him out because I'm very interested in this, and his particular initiative does not cover this area that I have an idea about. Or there's a problem over here that no one has touched before. I think I'm going to solve that. I'm going to try to connect with the other contributors who might be interested in this problem, given that it's in a particular area of concern. And I'll get them together, and then we can collaborate in solving this initiative. So it's important that we use a centralized facility like this to coordinate our activities and moving forward, so that we reduce the duplication of efforts and we harness that amazing potential that we exude in all of our solutions to create real targeted impact as we move forward. So finally, there's a contributors page. Some of us have registered and put very flattering photographs of ourselves on this page.
Thank you.
I'll invite the rest of you guys to obviously register. Create your profile. It's very important because this particular area here is linked to your initiative. So if you know, there's someone else who's working within your problem space and you want to reach out to them, this is where they, you know, this is what will help under the circumstances. So this is the first cut, the MVP of the co-acting platform. There may be bugs in the platform, but given that it's under a week of work, I'm sure you'll forgive us. So what I'll encourage you guys to do is go to coacting.org and register if you haven't already. And all of the amazing initiatives that you've presented in the initial segment of the hack solve, I'll urge you to populate this system with enough details about it. You should be able to post screenshots as well on your initiatives, so that we have a full gamut of problems, initiatives, and contributors to move forward with the hack solve. So I'll leave you to do that. We'll take a break, eat our virtual snacks, and then we can come back a bit later. I think the schedule shows around 7:30. That we have it. Yeah, I think it's 7. Yeah, 7:30 would be our breakout brainstorming. So that'll give you enough time to register, browse the problem areas, identify which problem that you're interested in solving, so we can come back and identify who we're going to be working with in the breakout brainstorming sessions moving forward. Sounds good? Sounds good. Can I hear you?
Sounds good.
Yes.
Yeah, I think this is good.
Yeah. So
All right, cool.
Slack us if you have any issues with the platform. If you have any questions whatsoever, just Slack us. Everyone should be connected with Slack, correct? If you're not, then message the Nexus Help page, or message me directly if you have my contact, and I'll be sure to send you the details in terms of getting onto that Slack group. All right?
Okay.
I think we can send it right here in the chat.
Yes, I can send it right here in the chat. Good. See, you know, multiple heads are better than one. Let's see here. Good. So let me post that. Where is what I'll post in the chat is the link. As a matter of fact, Chris, you might be able to do that quicker than I, because I think I should be able to do that. So the link. Let me see. Grab the link really quickly. Oh, here it is. So there's an invite link for Slack. Great. So Chris just posted it in the chat. Make sure you click on that if you're not part of our Slack group. That'll take you right into the Hack Solver channel, where everyone is at the moment. You can share, you can just exchange messages, and we're going to use Slack when we come back to create our focus groups, our breakout team groups, based on the problems that we survey that we want to solve. Most of you have initiatives already, I believe, so you're pretty much already locked into your problem areas. But it's important that you register that on the canvas, so we can have this bird's eye view again of who's doing what, so we can align our efforts better. All right. So just yeah. Go ahead.
At 7:30, you want us to just link back up in Slack, or do we form another call, get everybody in and out?
All right. Yeah, that's a good thing. So what I'm considering is that the breakout teams can use their own Jitsi sessions or Google Meet sessions or Zoom sessions, whichever you prefer, to have that real-time virtual communication going. Alternatively, we can do the Slack. We can resort to Slack if you wish, but it'll be good to have a session like this going, whereby we can have an open discussion, an audible open discussion on how we choose to, form these breakout groups. All right, so we'll just check in back with you around 7:30. We'll use the same Jitsi session around 7:30 to just see where everyone is, and then we'll take it from there. Okay. Any questions?
Sounds good. I kind of have an idea of what I specifically want to target. Is Jason here, Barnwell?
I don't think he is. Not yet.
Okay, just more or less, I think one of the major breakouts group is going to be those of us who are going to kind of look at particularly that synergy aspect when it comes to getting as much help as possible to those in risk, as well as facilitating just as much people being able to self-test in a sense. So I can definitely see myself, Dina, Jason, a lot of us who've worked on Michael, worked on our side of the application, linking up with Julius and whoever his team may be, and having that deep diving session. So I'm just going to necessarily kind of claim that breakout group for now.
Okay.
In a sense.
Cool. Then I would like to deal with the payment stuff, because there's been some new stuff that came out last October from the Central Bank of Guyana.
Okay.
Yeah.
All right.
Another one I probably might not have the bandwidth to necessarily oversee. Probably, not sure if Canada or anyone other guys want to take this, but particularly the looking at from economic standpoint. So like Samantha says, they're kind of working on this delivery platform. STEM Guyana has this ideology of connecting merchants to kind of establishments, right? And that kind of falls into this area of how do we create job employment and how do we facilitate people in this given time. So I think that is also something that conversation that needs to be had.
Great. Yeah, guys. I think we're off to an excellent start. Slack channels, that's next. Take the time, sign up on the Coacting platform, post your current initiatives if you have them, and just take a look at the problem set that we have to work with. Good. All right. So we'll connect back at around 7:30. Most likely by then there'll be focus group channels already available on Slack. All right. Great.
Excellent. Thank you so much for everyone who's contributed so far. There are like so many ideas. My brain is spinning the spin-offs. I look forward to seeing you guys again. Thank you.
Yeah.
Thanks, Ryan.
Just an hour and a half.
Good.
So see you guys soon again.
All right. Take care, Samantha.
Yeah.
Good.
All right. So.
Elena, we facilitated any kind of like new signups. I was thinking we could.
I'm open to the idea.
I'm just thinking.
If you have any friends that sort of missed the sign up, then just share the Slack invite with them.
Yeah, so a lot of the people who necessarily onboard their teams that weren't necessarily a part of this conversation. And I guess we can, I'm not sure if we recorded this session or if it'll be recorded by the fact that we did the live stream.
Yes.
We can probably gather some sort of social media posts
Yes.
At
They're
least
already started.
outlining that these are the what we've targeted. We can probably talk to Clean to create a quick infographic for that. This is what we're necessarily focusing and targeted on, and if people all of a sudden have that interest, we can facilitate them joining.
Yeah, absolutely. All right, guys. So loop back 7:30. Take care.